Lisa.
I'm Asma. So now we are going to talk about
Wolff-Parkinson-White syndrome.
Wolff-Parkinson-White syndrome is a condition where there is a necessary pathway connecting atria and the ventricle. Normally, our heart beats in a set of motion by an electrical signal from the SA node. The electrical signal spread across the cell of our heart's right and left atria. This signal causes the atria to contract and pump blood through open valve from atria into the ventricle. The signal will arrive at the SA node. Here, there is a delay to allow our heart's right and left ventricle to be filled with blood. The signal then moves along the bundle of His. Then the signal are divided into left and right bundle branches, which run through the septum. The signal spread quickly across our heart ventricles and push the blood through pulmonary valve to our lung and through aortic valve to the rest of our body. As the signal passes, the wall of our heart ventricle relax and wait for the next signal. However, in this syndrome, a form of supraventricular tachycardia, the heart cannot work normally in this way. Instead, the heart's electrical signal re-enters the atria over an abnormal accessory pathway that bypasses the normal electrical system called bundle of Kent. This allows electrical signals to pass between the ventricles and atria. This signal disrupts normal timing of heart electrical system, causing atria and ventricle to beat so fast. The sign and symptoms of white Parkinson. Yang tu kat dah. Okay dah.
The causes of this syndrome is extra electrical pathway in heart lead to rapid heartbeat is present at birth. And the other is the mutation of the PRKA2 gene inherited from autosomal dominant pattern. The syndrome also associated with congenital heart disease such as Epstein anomaly. Normally, our heart electrical impulse that generate each heartbeat is produced by sinus node. The rhythm of the heart controlled by sinus node. This electrical impulse travel across atria until arrive at AV node. The AV node slow the electrical signal before sending it to ventricle. In this syndrome, extra electrical pathway connect the atria and ventricle allow electrical impulse to bypass the AV node and the ventricle activated early and cause two major types of breathing disturbance. Firstly, loop electrical impulse. This condition where electrical impulse creating complete electrical loop signal and send impulse to ventricle at very rapid rate, as a result causing rapid heartbeat. Secondly, disorganized electrical impulse. Electrical impulse do not begin correctly in right atrium and causing atrial fibrillation. The disorganized signal and extra pathway of this syndrome also can cause ventricle to beat faster and ventricle don't have time to fill with blood. For this treatment, we have 4 treatments: medication, therapy, long-term treatment, and open heart surgery. Okay, for the medication, we can use antiarrhythmic drug. May be used to control or prevent a rapid heartbeat. For emergency treatment in this syndrome, patient with hemodynamic instability is directed toward converting breathing to sinus through a brief episode of AB block. Adenosine is the drug of choice for immediate conversion of narrow complex supraventricular tachycardia, called as SVT, but should not be used for periacidic atrial fibrillation. Esmolol has also been used with some success. Next is beta blocker, are probably the medication commonly used to treat SVT in presence of pre-excitation. They are moderately effective and have frequent but rarely life-threatening adverse effects. More potent medication, example as flecainide, propafenone, sotalol, or amiodarone, may have more effect on accessory pathway epiconduction, are refractoriness than beta blockers and are preferred by some. The use of verapamil for long-term therapy appears to be contraindicated for many patients with this syndrome because this medication may enhance atrogate conduction through the epi by increasing the refractory period in AV node. In addition, digoxin may shorten the refractory period of epi, further enhancing its atrogate conduction. If the heart does not return to normal with medical treatment, the therapy called electrical cardioversion can be used. The doctor uses pedal on your chest to electrically shock your heart and help restore a normal rhythm. Next is the long-term treatment, is catheter ablation. Catheter is inserted into a vein through a small cut near growth up to the heart area. The small area causing fast heart rate is destroyed using radiofrequency or cryoablation. Lastly is the open heart surgery to burn off or freeze the extra pathway.